Hello. I had the test with the urologist where they go up my urethra with a camera and they look inside my bladder and then they fill my bladder with water and see what's going on. It looked totally normal. In fact, I had the most odd compliment I've ever received in my life. He said, "Your bladder is the most beautiful bladder I've seen in a long time." Why, thank you. Yeah, from a structural standpoint, from the inside looking at it, I'm fine. No tumors or anything like that. Not that I was really concerned about it, but nice to know that I don't have anything like that. He thought that it might be a nerve issue or something along those lines. He also mentioned in our first consultation the fact that I have endometriosis. That could be playing a role in the issues I've been having in my bladder, the pain that I've been having all the time in my pelvis, but especially when I try to urinate. Yeah, it's just not something that I've really dealt with before. The urologist, there's nothing more that he can really do, so I was directed towards a pelvic floor therapist by both my PT and the urologist. So I found this gal who is amazing. She can use a pelvic ultrasound at the same time as me using my pelvic floor and things like that to see if I'm doing it correctly. The restorative PT that I've been going to for the last 2 years was concerned that I was bracing in my pelvis when I was supposed to be lightly using my pelvic floor and all the other stuff that she's had me do. I went to a pelvic floor therapist. She was so sweet and really knowledgeable and caring, and it was great. It was just last week I went to her, and she has worked with a lot of people who have issues with endometriosis, and she said that can be a huge factor when it comes to bladder issues and all kinds of different issues. So I was diagnosed with endometriosis many years ago, and it was a clinical diagnosis, so it was adding up all the different factors, the symptoms, the issues that I have, coming to the conclusion that I had endometriosis. It seemed pretty apparent that that was what was going on. I have my IUD, the birth control in it helps the endometriosis, if that's in fact what I've been experiencing. That revolutionized my life. It used to be that I had horrendous periods and I would bleed for 2 weeks at a time. People said that I bled like someone 2 times my size, that it wasn't right. I'd spend an entire week of it in bed, oh God, and yelling out in pain. It was so intense. And the other 2 weeks was all PMSing and feeling horrible leading up to it. So it was like an entire month every month that I was out of commission. And when I received the hormonal IUD, it revolutionized my life. It saved my life. It was the first major thing that we had found that helped me be able to not just be in bed all of the time. It leads everybody to believe that's what I have, but they never did a laparoscopic or something like that. Where they actually do a tiny little incision and they go in and check to make sure I actually have endometriosis, because everyone said, because of all the other conditions that I dealt with, that it wasn't a good idea just to assume that I had it and move forward. So now that I'm having all of these other issues, it could potentially be the endometriosis getting worse. Definitely need to have that checked out. I was told to go to the endometriosis clinic in Portland. Since they're specialized in it, they're able to determine what a normal doctor might miss when it comes to endometriosis. So hopefully they can do something real simple like that, but they might have to actually go in just to see if that's in fact happening. And if so, that would make sense that I'm having that going on with my bladder as well, and that also affects pelvic floor. So many different things. I need to go there to make sure, so we really know how to move forward. And if it has spread, do I need to have a hysterectomy? Do I need to have some other procedure where they remove the lesions? We will find out. It's gonna happen. I'm gonna figure out everything that's going on with me, and we're gonna fix it, and I'm going to live my life to the fullest. I am determined. That is what is gonna happen. So trying to continue to focus on that instead of all the negative that I could very well focus on. So I didn't really talk a lot about the pelvic floor therapist, except for that she recommended the endometriosis clinic. When she manually checked what was going on with my pelvic floor and stuff while I contracted my pelvic floor and released it, and she said it's very responsive, which is a good thing. Immediately when I tightened it up, it tightened up. The issue that I have is once I try to relax it, it's like really challenging, and it kind of does one of these deals. Makes sense that I'm having a hard time relaxing it when there's just so much going on there. As far as she can tell, I'm not bracing or doing anything like that, so that's good. And she touched one area and I was like, oh, that's sore. It was like a 5 out of 10. 10 is like, I'm dying. So 5 is pretty strong. But then she had me breathe into my pelvis, which was really interesting. And then she was like, how is this spot? And I'm like, a 1. And she said, that's the same spot I just touched that was a 5. And I was like, what? Are you kidding me? And she said, yeah, that's how quickly things can change with the pelvic floor. So that was really exciting and very encouraging. Yeah, and she just told me all these different things about how the pelvic floor is just so much bigger of an area than I expected, because people do Kegel exercises and it feels like it's just this one area in your pelvis, but really it encompasses a much larger area. And it also affects the bladder, intestines, the various things in the pelvic area. We know that that's definitely a huge issue for me, is the pelvis and pain and all that. Yeah. She should be able to give me kind of a routine, some exercises, things to do for it. She said even the pelvic floor can affect your neck and headache, and affects all of it. It's the base of your whole body and structure, and so if it's off, then the stuff above it will be off. I just found out a whole bunch of stuff about endometriosis that I had no clue about. One was endobelly, when belly gets really hard and distended and painful and doesn't feel like there's any reason why it's doing it, it's just doing it. Yeah, endobelly. I thought that was really fascinating. We covered so many different things that it's hard to remember them all. Unfortunately, that's kind of how it is with every doctor, because there's just so much going on in my body. Luckily, the last so many doctors that I've been seeing, they have been very understanding and used to people like me even, which is definitely new for me. So it's nice, and it's confirming all these different independent doctors looking at the same things, coming up with the same diagnoses, telling me that, yeah, if you have one of these, you're more likely to have the others, and often they all come together in a package. It makes me feel like I'm not crazy, that I'm not something out of the norm that no one deals with, and therefore they can never figure out what to do. It's just such a relief and so encouraging to find doctors that actually care and understand where I'm coming from. Like, oh my goodness. Every single one that I'm going to. The injection doctor, my restorative PT, my specialist for fibro and HEDS, and all of the other things that I've talked about. Pelvic floor therapist. It's incredible, and such a change from the last 21 years until we got to the last 2 years that I've been doing all of this. Yes, so grateful, so very grateful. I see her again Thursday. I will see her every other week for a short period of time till we kind of have a game plan of what I can do. The endometriosis can most definitely affect the pelvic floor as well. If we can get the endometriosis under control, it might solve a lot of other issues that I've been dealing with. This might be TMI, but many times throughout the years, when I'd have a bowel movement, I would have blood that would come out. I know, yummy, right? But yeah, that would happen, and I would talk to various doctors, and they'd just be like, oh yeah, that's normal. And I'm like, don't see how that's normal. That doesn't seem right. Yeah, that's the response I would get. And so I'm like, okay then, thanks a lot, super helpful. And I told this to the pelvic floor therapist, and she's like, no, that's not right, but it is very common for people with endometriosis. Which I was like, geez, it affects so much more than I ever imagined. And it could be what is going on with my stomach even, and so many different things. I don't want to get my hopes up because it might not be so cut and dry. Then again, it could be. It's just really, really intriguing. So many different things that I was like, what's going on with my body? And she's like, yep, normal for endometriosis. Yep, normal for endometriosis. So, yay! So many new things, just continuing to move forward. We get to the next layer of issues that we need to tackle, and we tackle them, and then we move on to the next and the next, and there's not a lot left. So that's really, really exciting that I'm actually gonna have my life back. Yay. Thank you so, so much for this. I don't know how many times I can say it. It would not be happening without everybody's help. So thank you, and continue to send me good energies and to pray and be positive. It's gonna happen. We've got this. Thank you. Mwah.